So I think that, anytime you're having pain in your shoulder, and you say, I've got this problem and it's been there for a while and I've tried X, Y, and Z, and it hasn't worked. I've tried injections, I've tried therapy, I've tried all these things. And really I'm considering having an operation to fix this problem because it doesn't seem like anything else is going to solve the problem, right? So, but even when most patients or most people get to that point in their life, there's a lot of fear about surgery, right? There's a lot of fear. And so this video is me just really outlining some of those fears and all the things that we do that are unique in our practice that help minimize the risks of that those fears basically outline. So I think, just kind of starting at the top, the number one fear is this surgery actually going to work, right? Like, is this surgery going to solve my problem? And I can tell you with very strong certainty that the answer is yes. And the reason why I can say that is because I've tracked my outcomes in our practice. We've tracked our data, we've tracked our outcomes. 98% of our patients are very happy with their shoulder when this is done. And by very happy, I mean they have minimal to no pain. Their function is light years better than it was before surgery. And they're very glad that they had the operation done. So I think that's the first question is will this surgery work? And I think, and really with 98% accuracy or 98% certainty, I can tell you yes, the surgery will work. Patients are really worried about, people fear being under anesthesia, the risks of being under anesthesia, being put to sleep, and that's totally understandable. I mean, you completely lose control. There are risks involved, and we try to minimize those risks as much as possible. And the thing that I'm in control of as a surgeon that I have the most say in with is how long the procedure takes. And so the average shoulder replacement time is over 2 hours. That's the average time for most surgeons. We utilize 3D printed guides that are patient specific. We use the most minimally invasive techniques. I've done over 1,000 of these procedures and have an amazing team of people that help me in the surgery that allow us to do this surgery in less than 30 minutes on average. Less than 30 minutes. We use minimal blood. We use, the smallest incision we can make. And so we do this procedure in less than 30 minutes. So I think when most patients hear that and all the technologies that we're using to make that happen and still doing very accurate, high precision surgery that way, hopefully that allays some of your fears to know that you're really gonna only be asleep for the procedure for, around 30 minutes and not several hours being put to sleep. So that minimizes infections, right? By having a shorter surgical time, it minimizes the risks of being under anesthesia. If you're under anesthesia for 30 minutes versus 3 or 4 hours, that's just less risk, less stress on your body. It also decreases pain. We know that the shorter the surgical time, the less pain patients have, because it's just less stress on your body. So other things that patients are worried about is really the pain after surgery. And the vast majority of our patients have minimal to no pain after we replace their shoulder. I'll repeat, like minimal to no pain. And we track that. Like we have outcome databases, and we also listen to our patients and they tell us this, right? So I think that the pain that patients feel after the surgery is on average way less than what they had pictured in their mind. We do again, minimally invasive techniques. We do this surgery extremely efficiently in less than 30 minutes. We do a multimodal pain approach afterwards where we do nerve blocks and a litany of medications that are non-narcotic. So not only do we minimize your pain, but we do it in a way that's very low risk by, treating you with many medications that are not narcotics that have fewer side effects so that we can achieve that goal of no pain without giving you a bunch of dangerous drugs that can be addictive and have multiple side effects that we don't want. So most of our patients take minimal to no narcotics after the procedure as well. I think other things patients are worried about is just how long is it going to take to get better, that the rehab is going to be brutal. And so we let our patients start using their shoulder right away. So we don't keep you with a shoulder replacement. We don't keep you down in a sling. We give you a sling to wear for comfort after surgery, but we let you start lifting and using your shoulder right away. And most of our patients, the vast majority of our patients, when we see them back 2 weeks after the operation, they say their shoulder is better than it was before surgery. So within 2 weeks, your shoulder is already feeling better than what you started, and it just continues to improve from there on out. So many people are worried, this is going to take 6 months to a year for me to see any relief, and the rehab is going to be brutal and all these things. And that's just not the case with the majority of our patients. They have way less pain quickly after the operation. The procedure is not nearly as painful as the vast majority of them pictured in their minds. And they can start using their shoulder much quicker than they anticipated the majority of the time. And again, how quick is my shoulder going to feel better? Really within 2 weeks is the average. And then the last question is, is this surgeon, right? Like, am I the right person to replace your shoulder? And all I can tell you is just the facts. And the facts are that I've done this surgery over 1,000 times, right? This is the primary focus of my practice, and I am passionate about shoulder surgery. I was trained by the best shoulder surgeon in the entire world, in my opinion, and many people share that opinion. And sad that he just retired, but happy that he's able to get some rest. And I just want you to know that I'm going to do everything in my power to fix your shoulder and continue to evolve to become the best that we could possibly be at this operation.